Hello, Pahrump. I'm Dr. Michael Reiner, your host for the Independent Doctors of Pahrump. And tonight is, of course, you won't see that little recorded thing, so this is a live show. And that call-in number will be 727-8750. But at the close of the last show, I alluded to the fact that I had a new announcement, and that was that I had joined with Dr. Christensen, Creig Christensen, who's here with me tonight, and we have started the Independent Wellness Clinic, or Independent Wellness Center. I get that clinic and center mixed up, but anyway, this is the building right next to the Veterans Administration. It was Spring Mountain Chiropractic at one point. So we basically have been talking about this, and I think it's a great lead-in for a mix for both of our practices and what we do. We think a lot alike, and this is a great endeavor. And without any further ado, you have my new associate, Dr. Christensen.
Thank you, Mike.
Yep. And I'm glad you're here on the show tonight. And what I think, we encourage the callers, and you can talk about anything, but what I wanted to do is, introduce Dr. Christensen. I know he's got a following kind of like I do in Pahrump. I think he's just as busy as me. You've been, how long have you been here?
I've been here 4 years.
Okay.
I've been here in the Valley 4 years.
And you have quite an illustrious history where you were basically in California. And one of the things I like about you did a tremendous amount of sports medicine. Why don't you tell the viewers out there your background there? So.
Yeah, I spent 30 years in Southern California, which is probably one of the hottest beds for athletes and athletics in the country. I was blessed to work with a lot of pro athletes. I was blessed to do the rehab, post-traumatic, post-functional rehab on a lot of high caliber name patients. I worked with the Dodgers, I worked with the Angels, we worked with the Raiders, we worked with the Rams just before they left, and now they're back, and we're real excited about that. Spent some time with the Padres and spent some time with the performance training program over in Dallas, working with the Dallas Cowboys. Met a lot of great people, got a lot of great exposure. And really enjoyed myself.
A lot of experience in sports medicine and rehabilitation medicine.
Yeah, rehabilitation was my primary focus, post-traumatic, post-surgical rehabilitation. So yeah, I was pretty blessed to be in an area where I was able to work with kids at a young age before they even went to college, and then they ended up going to college and ended up going into the pros.
Well, that's cool. That's really cool. So hold on to that thought. We have Louie on the phone. Louie, are you there?
Yeah, I'm here, Doc. I'm here. I got a simple question for you.
Sure.
Okay. Now, my question is, how dangerous is stress to our overall health? Because we all go through stress and stuff, Doc. And I was just wondering, does that lower our immune system, or what does it do? And like I said, how dangerous is it to our overall health? And that's just my question, okay? All right, thank you.
Yeah, no, I mean, stress is very, very dangerous, again, to your overall health. But there's different degrees of stress, and everybody deals with stress differently. So that depending on what you do with it, will determine how dangerous it is for you. So if you totally internalize everything and it changes your outlook on, I guess unresolved stress will lead to depression, situational depression, and all of these things. If you think of the body on a pure molecular level, and the energy that's involved in the body and in the cellular structure, when you're wasting that type of energy on things, you're not utilizing that energy towards your immune system. You're not utilizing that energy towards good things. You're using it towards bad things. And that's why you have to get in touch with whatever it is the stressor, because you can treat the stress with medication, and you can treat it with antidepressants, and you can treat it with counseling. But if you don't really understand where the stress is coming from, you'll never resolve the stress. You may bury the stress. I mean, you could go subterranean and you think you're okay for that particular day, only to have it come out in someplace else. So, last week I had Peaceful Minds on there. So sometimes it helps to talk to a person that is not involved in there. So one of the things that you're in tune with is that when stress gets into your body, and then it starts to tighten up a lot of the muscles. And I can even feel that at the end of a day when things are just really tight. My neck and my shoulders start tightening up. Then that can pull on your neck, and then the neck bone is connected to the backbone, which is connected to the hip bone. I mean, all these things are interconnected. Not to mention heart disease and gastrointestinal side effects, alternating diarrhea, constipation, irritable bowel, not being able to digest your food, strain on the heart, increased blood pressure. I mean, it goes on and on and on. So, I mean, if you understood diabetes, you understood medicine. If you understood stress, you probably understood the world and everything around there. So, I think it's really an unknown factor, but sometimes, unfortunately, it's a disease happens, and you didn't realize that stress was playing the role in what that
Absolutely.
happened.
And as you mentioned, the Western approach or medical approach to that is the medications and the drugs that you use to help reduce the stress. At the Wellness Center, what we will be stressing is a lifestyle change, which you alluded to, as far as talking to your therapist and changing a lifestyle. Adding more exercise, looking at the diet, looking at the nutritional factors that are involved, looking at, are you sleeping, what's going on here, and trying to change a lifestyle which will eliminate that stress naturally.
Yeah, and we hope to actually have a sleep lab where that's in the process too, because I find that is one of the bigger unknown and unresolved issues today is abnormal sleep patterns and our abnormal sleep architecture. I've discussed it a little bit on the show, but it's very important that in today's thing, once you get an injury, and you deal with a lot of injuries, depending on the nature of the injury, people become sedentary, and when they become sedentary, they gain weight, and when you gain weight as a male, you lose testosterone, you lose energy. If you lose testosterone, you gain further weight, you do further further bad things can happen. So it becomes a very vicious cycle. And once you start to gain weight, then you basically can develop sleep apnea, which further enhances testosterone loss, strain on your heart. So, getting people back to their state of health and their activity level is extremely important as quickly as possible.
You got to get them moving.
Got to get them moving. Got to get them moving. We have Ray on the phone. Ray.
Hey, Doc, how's it going tonight? I see you got a guest, Dr. Christensen, huh?
Yep.
Hey.
Hey, I got a question for Dr. Christensen. I got a friend named Paul who has a problem with his back, a serious problem with his back. It was caused by radiation from like 20-some years ago where they irradiated him and went too deep.
Yep.
He can barely walk now. And he goes to the VA, and they're doing just about nothing for him. Is the Wellness Center affiliated? Can they somehow get some finances through the VA to take care of it, or is he just stuck in the same mode that he's been going through for the last few years?
Boy, the VA system, Ray, is a tough system. One of the things that Dr. Reiner and I have talked about is reaching out to the community, the veterans, especially the veterans, because they need our help more than anything. There are absolutely things that can be done for him, Ray, from a natural standpoint. Again, we want to increase activity. We want to increase, change lifestyle. 20 years ago, when he had the radiation, things definitely changed for him. So yeah, there are things that we can do for him.
And I think there's Ray, you may know, as well as anybody who hangs around there, I think they instituted a new payment system so that if services aren't offered through the VA clinic and they have to travel a certain distance.
It's a 60-mile rule, but I don't know if it's going to be, as far as this case. But I'll have them get in touch with this Wellness Center. And
Ray,
if Dr. Christensen can help them,
Yeah, the other thing is, do you know whether or not they have patient advocates for the VA out here? I mean, are there...
He just keeps talking about you got to get I forget it's a word, you got to get some kind of doctor at the VA, the local VA, to approve anything to get anything done.
Well, that's putting a little bit of
I can't believe that anybody could go through that and still remain sane.
And you know, radiation is one of those things that it's an interesting topic, and I've talked a little bit about it, even in the office, just about the difference between classifying radiation exposure, such as RADS and sieverts. Sieverts is a measurement of radiation, basically exposure, and the health risk associated with sieverts, and RADS is radiation accumulated dose. So basically, there's two different things. They both essentially could mean the same thing. But I have this tiny little Geiger counter, and they're really kind of cool. It's made by Soekes, or S-O-E-K-S. It's a Russian place, and I guess after Chernobyl, they started making a lot of those. They made a lot of those Geiger counters, but it's very interesting. Normal background radiation is 0.2 microsieverts, okay? 20, you could call it 20. And when you go up to 50, then you're outside the background radiation level. And so I'm using this thing outside, just seeing what the background radiation, and it's actually pretty low. I mean, there's nothing here. You know, you think being next to the test site, you would see a lot of background radiation. There really is very little background radiation. Now, as I drive to Beatty, when I get through, what's that town, Amargosa Valley, but it's that other one out there. That background radiation actually goes to 0.3, 0.4.
Is that right?
Yeah, so when the wind's blowing, so you're getting a lot of radiation from, the test site. We're going to go to break. Come back, we'll talk a little bit about radiation and how to heal your back and some other things. I'm Dr. Reiner. Thank you for tuning in. Hi, I'm Dr. Michael Reiner, your host of the Independent Doctors of Pahrump, a TV show that airs Monday night on Channel 46. I want to remind you that I am a practicing physician in Pahrump, and I'm an independent practitioner, which means I am not bought by any insurance company or corporate medicine. We provide the highest level of care. We have nurse practitioners. We have other physicians, specialists who come to our office. Please come visit me. I'm at 1316 East Calvada here in the heart of Pahrump. Thank you.